Okay.
I think it's very important to have workshops because we can be smart and we can study books and we can learn a lot of facts, and we know how many people have a certain disease, we know what the causes are and what the treatments are, but until you practice it, you don't really understand it. So it's the difference between being given a fish because you want to get better, let's say, at something. Or if you're a patient, this is what I did and now you're better, you can eat for a day. But if you are teaching somebody to fish, then they can do it themselves, they can pass it along. So it transforms what you know in your head to how you can help people. So I think workshops are very important. You know how we learn from watching people do things. That's how we learn to be surgeons. That's how we learn to do procedures. That's how we know what to ask a patient and what to do with that information, and then how to approach what to use first, what to use second, and then how to evaluate what that did. So once you have the knowledge base, how do you use it? You can teach somebody how to make tables or make chairs, but until you do it yourself, you really don't know what you're doing, because things will occur to you while you're doing it. Then you know how to apply what you've learned. What that means is that one person can train people to go out and help many, many more patients. So that how many patients can you take care of in one day? But if you train 50 or 100 other people to do something and to recognize a problem, and to recognize, oh, this is how I take care of this patient. I need to inject these muscles, I need to use this amount. You start out with smaller amounts and then you gradually increase. And you teach people how to take care of other people, and you magnify and multiply your own ability to do good that way.
Thank you.
Does that make